You're watching Bikasisa's Health Beat. I'm Mia Malan. We are 3 days away from our 7th general election since democracy. About 50 political parties are standing, giving us more choice than ever before, but not necessarily informed choice. During a recent Bikasisa webinar, we found out for you how some parties plan to bring good healthcare to everyone.
Hello and welcome to this Bikasisa elections webinar.
The National Health Insurance, it is going to obliterate that divide that is between the private sector and the public sector. And by so doing, we will have, instead of the two twin track system that we are having, there will be no difference between the private sector and the public sector, and all the facilities that will give everybody care, it will be done equitably and everybody will have access.
The NHI bill, while well-intended, poses significant risk to our healthcare system. Instead, the DA advocates for universal access to healthcare through governance reform and collaboration with the private sector. We will lower private healthcare costs, enhance accountability, and ensure access to prescription medication. Removing political influences from appointments, we will ensure that every South African receives quality healthcare they deserve.
I support universal healthcare, but the fixing of primary healthcare has to be a priority. By that I mean, for me personally, I will work and I want to work on the Standing Committee on Public Accounts to see how every cent is spent at every level of the healthcare system and to assist movements. I'm not going to Parliament as an individual. I'm going as part of movements. The critical question for me would be how movements work together with health committees, with the Minister of Health, and so on. Our duty is first and foremost to assist good civil servants, good public servants, and our duty after that is to hold accountable those who don't do their jobs.
What will serve the country and the majority of the population of the country is to have one public health system. The NHI currently still relegates the Black people, the poor people, people in rural areas to the same fractured, fragile health system that is dysfunctional because it still demands of them that they remain seeking help in those spaces which they occupy. We still have family members who cannot bring babies alive from a hospital because of a lack of cesarean sections, long waiting queues in hospitals. Even under this NHI that they think is a magic bullet, those conditions will not change because they are not doing systemic work that is required. They are still defunding the health system.
So outside where it's written president.
With the National Health Insurance Act now a reality, we asked HIV activist Yvette Raphael whether she has faith in its implementation.
Credit to the ANC, this is their thought, this is their idea. The NHI bill has been coming on for years, and I always say to people, I was part of the community advocates at the time who decided or spoke about and suggested some of the pilot hospitals in South Africa that were going to be part of it. However, the ANC keeps changing people. I don't think the current people in the ANC even understand what the NHI meant to those veterans who wanted the same health care for South Africans. A better option for us as South Africans is for us to really understand that our healthcare system is failed us. The ANC government has messed up the healthcare system. And I tell you, early 2000s, I was proud of being in a public sector. I gave birth to my daughter in a public healthcare system. However, when I think about what some people faced 5-6 years after that, it's just atrocious. one thing that I can say is that the public sector care for HIV is the best. The only problem there is the queues and the planning, but because of HIV activists and community, have we started to make plans to make healthcare better. For instance, people are able to pick up HIV medications for long months, up to 6 months, and that helps with the queues. However, I'm still worried about that. I'm still very worried about how people will access their services if somebody has to go to Netcare to go and pick up their ARVs there.
After the break, the right to vote and the right to health.
I can't put a name to the smoke that I'm inhaling, ne? But I am inhaling it.
Welcome back to our election edition of Healthbeat. We're looking at how important social justice issues are when choosing public representatives. Reforming healthcare, for example, seems pointless without addressing the underlying causes of sicknesses and diseases. These are often non-medical factors like living conditions and the air we breathe. This report is from an area in Johannesburg where residents say their rights to a clean environment are being stomped on.
Smoke thickens the air near Kaya Sand, about 35 kilometers northwest of Johannesburg. Residents from informal settlements to gated estates call it a toxic crisis. It is the site of uncontrolled illegal dumping, and the area has become a health hazard. Environmental health expert Renee van Wyk is from the University of Johannesburg.
Illegal dumping is considered a crime, and it happens haphazardly everywhere. But landfill sites are regulated, and a landfill site are based on engineering functions, and it's a controlled way of disposing waste.
But at Kaya Sand, there's no control. Trucks dump whatever they like, when they like. A wall separates Lucille Horse's house from a dump in the neighboring informal settlement of Msawawa. Informal waste trucks burn their loads here every day, releasing smoke from tires and plastic. Lucille says she can hardly breathe some days.
The asthma is now a family thing, ne? But the emphysema, it's a smoking thing, ne? And the doctor said that if I'm in smoke area where there's smoke, it makes the smoke makes it worse. Although I don't smell the smoke, but still I'm inhaling it, because sometimes then they're burning tires here somewhere.
Lucille, who hasn't smoked cigarettes in years, has to use oxygen to breathe at night. Her children cover the 2,000 rand a month she needs for electricity to keep the life-saving machine on.
It's fine.
During the day, she opens the door and window in her makeshift bedroom, hoping for fresh, clean air.
Even winter, the windows and the doors must be open, ne? For that fresh, for the air for me to breathe all right. Because at night, it's all right that I'm sleeping with the oxygen machine. So the doors can be closed, because that oxygen is not giving me my breathing much, make it a little bit all right. Ne? And okay, as I say, I can't put a name to the smoke that I'm inhaling, ne? But I am inhaling it.
Resident Keith Elliott started the Kaya Sand Burning Wasteland Community Forum last year, representing the residents of Kaya Sand and Msawawa Informal Settlement. He thinks the dumpers are part of a faceless mafia that's threatening residents if they dare to speak out.
So it's an illegal commercial dump. They're taking money. And that is what has happened with that is that there's been a proliferation of dumps. So we now know of up to 14 illegal dumps. And the problem with illegal dumping is that in order to make space for the dump, the next day's loads, they burn the waste.
To date, no one has proven a direct link between the dump and the ill health of Kaya Sands residents. But pollutants like sulfur dioxide and carbon monoxide from burning waste are known to be deadly.
And other health issues can include cardiovascular diseases, neurological disorders, and even cancer. And additionally, living in such environments can contribute to the mental health problems like people are prone to become more anxious, anxiety, depression, and stress due to the constant threat to their health and their well-being.
The community reported its concerns to the city of Joburg 4 years ago.
We've been working since the middle of 2020, trying to get the city to work with us. So we corresponded with them. They did site visits with us. We had one site visit with the executive and the directors of Pick It Up.
They were told that dumping had to be linked to ill health.
So one of the residents in our estate did get City of Joburg's health department to put up an air quality monitor. Now that air quality monitor was 2 houses down from where I live. And we got from the City of Joburg health department a report on that. And that proved that the air was hazardous and very hazardous at some points.
But when they produced an action plan in January 2022, he says the city ignored it.
When we confronted the City of Joburg with that information, their response to us was that that instrument was not properly calibrated. So they've actually rejected the results of their own air quality testing. So we have no option but to raise money for ourselves to do the air quality testing.
In its response to us, the city of Johannesburg said it could not say for sure what the impact of emissions was because no health assessment had been done. However, it is considering extending air quality monitoring to cover gases created by burning waste. Boka Dutoy lives on a farm not far from a waste dump.
The smoke we are talking about coming from these number of illegal dump spots comprises out of industrial waste. It's not veld fires or garden waste. We are talking about a huge industrial belt from Randburg to Lanseria. It's a very huge industrial area, and most of their dump ends off here for various reasons.
Boka says both old and young are battling with health impacts.
When I go into the communities, I often find the young children coughing. In one case, one was coughing blood. And I refer them or sometimes transport them to the local clinics for treatment.
He says residents of affected informal settlements are afraid to speak out. He thinks this is because many are undocumented migrants.
They don't have options here. They can't just move somewhere else. They are bound into this area here. And that's my concern, because if you see the smoke that they're living in 24/7, one can imagine.
Kid says the city has a constitutional mandate that it's not fulfilling.
Doesn't matter who you are. If you're living in this country, why should you have to live where the air is so polluted?
The city of Joburg says it has taken action against companies found dumping and that some of them are being criminally investigated.
After the break, How do citizens fix something as massive as the Kaya Sands illegal dumping sites? You with Healthbeat, I'm Mia Malan. We're discussing some burning election issues, including the right to a healthy environment. In our insert, we saw illegal dumping sites spiraling out of control in some of our cities. While many political parties have lofty climate change ideals, ordinary citizens often struggle to get their elected representatives to act. With me to discuss how residents can change their environment, aside from voting, is Mbali Baduza, CEO of We the People South Africa, an organization which promotes knowledge and understanding of our Constitution. Mbali, what does our Constitution say about our rights to a healthy environment?
So Section 24 of the Constitution says everybody has the right to an environment that is not harmful to their health and well-being. So that includes pollution and ecological degradation. But I think it's also important to talk about why it is in the Constitution. And it's because historically, landfills, for instance, have always been allocated to townships, to areas where Black people live. And Section 24 is there to redress the injustices of the past, but also to ensure that present and future generations don't live in conditions where there's indignity.
Now, last week we visited a toxic dump that residents say is out of control, and their councillors seem powerless to act. What's your advice to them?
Keep going. It's important to organize, to mobilize yourselves, and I see that they've already done that. An extra step that they can do is get, solidarity from other movements or other communities who are going through similar issues, because what is always a fact is that there is power in numbers. And I think what's important is that we ask the right questions. And one of the questions I would ask is, where's the money, right? So there is a budget for waste management that comes from national treasury. It goes down to province, and then it gets filtered into local government and districts. So how much was allocated for waste management, and is it being used correctly, or is it being underspent? I would start asking those questions.
And what can their councillors do better?
Read the Constitution. know what your job is, right? Know who is responsible for the delivery of a particular thing. So for instance, when it comes to the environment itself, that is a function of national and the province. When it comes to air pollution, that is a function of the local government. So in order to be effective, you need to know who is responsible for what and push on those points.
Mbalisa, how do these residents avoid costly legal action?
So our democracy affords us tools that we can use that were established by the Constitution. So for instance, we have Chapter 9 institutions. If you feel like your rights have been violated, you can approach the Human Rights Commission, and that sits in all of the provinces in South Africa. If you feel that or have evidence that funds have been misappropriated, you can approach the Office of the Public Protector, who also sits in all 9 provinces. But you also can protest and petition, because our Constitution allows you to do so in terms of Section 17. And recently, a law has been passed where you can petition Parliament directly instead of going through an MP to resolve an issue. So we use our tools.
What is on your wish list for climate in South Africa?
The first is to mobilize finances domestically, particularly for adaptation and resilience, instead of us only relying on international funding to help us through this crisis. The second is our climate action has to prioritize frontline sectors. And often, we think of energy sectors, but there are also sectors such as the healthcare sector and education sector. This is because in any given crisis, they are frontline sectors, and we need them operational throughout any situation. So I would prioritize those sectors. Thirdly, I would say we need a climate justice agenda that's transformative, but that also targets, our social and economic ills such as unemployment, inequality, and poverty. Because if we don't do that, there will be people who are left behind. And a law or policy that can help drive that is, a focus on socially owned renewables as well as publicly owned renewables. We should start thinking about things like that.
Bringing that back to the elections, do you see any of these things on your wish list playing out sufficiently in the manifestos of election parties? And why would it be short-sighted not to have a comprehensive policy when it comes to climate change?
Yeah, I haven't seen quite a lot of that. The focus has been elsewhere, popular discussions, which is, it is short-sighted because the climate crisis is here, right? It's not some future event, and we are being hit hard, and we're being hit differently depending on where you are in the country. We have long drawn droughts in some parts of the country, and we have heavy rainfall in some that cause flooding. And without a coherent policy, we will be found wanting. What we will do is we'll just react, and when we react, it'll be too late. And again, the same kind of vulnerable groups are going to be affected the most because they have the least resources to recover and adapt.
What would you say to a party that, for instance, doesn't believe in the just transition? And maybe just explain what the just transition is.
People think it's a buzzword, but it's not. The just transition is saying, as a country, we would like to move away from a fossil fuel heavy country and move to a more low carbon intensive economy. And the just aspect in that is that there shouldn't be any major losses, job losses, livelihood losses. Instead, the just transition is an opportunity to move to a different kind of world that takes everybody with them and centers the vulnerabilities of certain groups so that they are not left behind. And the Presidential Climate Commission released a just transition framework that was adopted by Cabinet that says the way in which we do the transition is by being guided by 3 principles. And the first is distributive justice, it is restorative justice, and is procedural justice. So when we have these principles, we are a step ahead in moving in a just transition.
So what happens if a political party doesn't take that seriously?
Well, there are people mobilizing on the ground, right? We have the Climate Justice Coalition, for example, and that Climate Justice Coalition is a coalition made up of South African trade unions, grassroots movements, NGOs, youth groups, who are taking seriously the need for us to push government, whoever is in power, whether it's local, provincial, or national, to take seriously the needs the climate crisis requires us to attend to. So they should be ready for a fight on their hands.
Mbali Baduza, thanks very much for your time today.
Thank you, Mia.
That's our May program. Vote wisely and well on Wednesday. Your health may depend on it.